Today, Great.com talks with Sally McAdoo, who is the medical director of the Kidney Cancer Association. If you have not heard of them, they are a global community dedicated to serving and empowering patients, doing everything in their power to be a universal leader in finding the cure for kidney cancer. If you're new here to the podcast, please press subscribe on your YouTube and your podcast app, because today we are going to learn more about the causes and impacts of kidney cancer, but more importantly, where the industry leader believes that this field is headed over the next few years. Miss Sally, welcome to the podcast.
Thanks for having me. Appreciate it.
I mentioned this offline, but I have to do it online as well. Of the Great.com tenure, how long I've been here, I've talked to people literally all over the globe. But for the first time, I'm talking to somebody that is in my city, which is so cool. Yeah, which is so cool. So
and we're still sitting in separate rooms. So
I don't know how that's possible. Thank you so much. It's really cool to be able to talk to you. I'm waiting to hear like a y'all or a Southern drawl. So keep your
one in there. Yeah.
Kidney Cancer Association. I mean, I think the name speaks for itself, but I'm going to ask the ridiculous question anyway. Can you tell us just a bit about who you guys are, what you do, all that good stuff?
Sure. We were founded back in 1990, so we've been around for quite some time. And back at that point, there weren't really any treatments for kidney cancer. So Eugene Schoenfeld sort of started the group in Chicago with a small group of patients and doctors to really find a way to start supporting the patients that are on this journey with kidney cancer, try and move the needle forward to give them something, to go on in terms of treatment. And over the last 30 years, we have given out over $60 million in research funds. We host conferences, we create educational materials, and we're really just striving to continue his mission of supporting the patients in their journey and moving that needle forward.
Yeah, I read online, you guys were the first and the biggest kidney cancer advocacy group.
Absolutely.
I think that alone is such a cool one-liner, but if I asked you to double click on that, is there any scale you could talk through about just sort of the growth or the impact that you've had that you're operating at today?
Yeah, well, I mean, even as short as 3 years ago, we had been a relatively small organization. There were about 2 people sort of running the masses and working with our steering committees. And now we're actually a team of 11 working really together, increasing those. You'll see some great new initiatives come out. So although we've been around for 30 years, we're sort of operating as a startup with some fresh vision and projects. So it's pretty exciting.
How about the kidney cancer side of this? I mean, so we talked, you're going from 2 to 12, which that's significant growth. You're heading in the right direction. How many people are diagnosed with kidney cancer? And that's a very specific question. Do you have any numbers around just how severe this is?
Yeah, it's definitely tracked all the time. Last year, the numbers were 74,000 people. This past year, it was 76,000 people a year are going to be diagnosed with kidney cancer. It's increasing due to increased imaging, finding these cancers, but just in general, people are a little more aware and sort of watching out for things of their own health. So we do see an increase in kidney cancer, which makes our mission even more important.
My and I did not mention this offline, but I've been able to see my stepmother, who's actually, she's filled the mother role for me for many, many years, has fought this battle twice, not kidney cancer, but she's been diagnosed with 2 different types of cancer, cervical and lung. And through that, there's a physical battle that you have to go through. And we could talk a little bit about that. But one of the harder parts, one of the more interesting parts when you're going through this is this question of like why it happened. And I think there's a spiritual question there, like why me, but there's also just physically, how did this happen to me? Why did this happen to me? Are there external factors at play? And when my stepmother was diagnosed with her lung disease, they talked about several potential influences. You grew up in League City and there are lots of power plants in the area. Your father was a smoker, and if you got secondhand smoke, things like that. For kidney cancer, are there specific levers or variables or influences? Like why do people typically get this? Do we have any information on that?
For cancer in general, one of the misnomers out there is that, oh, it has to be inherited. You have to get it from a parent, or somebody in the family is going to pass this along. And there's actually a very small portion, only about 5% or so, of any cancer that's actually inherited. A lot of cancers just happen brand new in an individual with no family history. And a lot of that can be due to some of the environmental things that you mentioned. But overall, age is a big part of it. As we get older, the check system in our body starts to break down. So these things that normally would start to grow and the body sort of nixes, go unchecked and start to grow and become these tumors. And then those tumors can spread. Things like your diet, your obesity can play into it, age. There are certain ethnic things that can play into increasing the risk or not. So I think the biggest problem too with cancer is it's not one entity. Sometimes people think, oh, that we're going to find a cure for cancer. But kidney cancer may operate differently than breast cancer. And even within kidney cancer, there's a bunch of different types that have, different characteristics about them that are going to need different treatments or different cures as we do that. And so it's still an unknown, which is what makes cancer so scary. And people worry that they've done something wrong themselves. Like, oh, did I, use the wrong product, when I was a teenager doing my hair? Is there way too much Aquanet that I used around me? Or have I eaten the wrong things? But there's no one answer. There's a lot of things playing together when it comes to cancer.
The answer you gave makes total sense as the individual dealing with it. That answer does not sit well. It's such a hard thing to deal with because you want something tangible and you're constant. It's so interesting. I've sat on the inside of this. And so I've been a part of these conversations, and you do so much digging and looking and searching and talking and asking for opinions. And you're right. There's just so much at play, and there was no history of this prior to my stepmother and nothing after. All the kids are fine. So it's so interesting. Do you find that there's a specific type of person maybe that's grown up in a certain region, that's of a certain race or demographic? Like, is there do certain types of people, are they more prone to getting this type of cancer than others?
We do see in the statistics, obviously, smokers, as with any other type of cancer, they not only break down cells, but increase toxins in the body, which can create those errors occurring. We do see in kidney cancer, specifically, men more than women tend to be more affected. And so it's really trying to dig at why that is, but we do know that's there. But no, there's no one thing you can point to, again, which makes it more frustrating than helpful for sure. Because if you knew what it was, you could avoid it.
How do people typically go about spotting this? Like, are they feeling pain in their lower back, like where their kidneys are at? Are they in there for some sort of just routine checkup and you catch it in a test? Like what's the more, how do people typically find this?
Yeah. So there is, back pain. A lot of people will write it off as, oh, I've gotten older, since kidney cancer tends to affect people mostly closer to the age of 60. It's like, oh, those normal aches and pains. Unfortunately, unlike breast cancer, where you can sort of feel for lumps, or colon cancer, where you may see blood in your stool, there's not really that sort of indicator with kidney cancer of like, oh, here's the symptom. I can feel that mass. Usually if you can feel it, it's pretty big by the time you can feel that with kidneys. There is blood in the urine is as a sign as well, but some people aren't necessarily, it could be traces and you may not see that for sure. So that's one of the things at the KCA that we really want to try and strive for, is we're happy with the changes that have been occurring with drugs and treatment, but we need to find better ways to help identify kidney cancer and diagnose it early to prevent those people from getting to the later stage.
Yeah, I'm smiling because you're going exactly where I was going to go. I want to ask you, what are the treatments? How could we solve this? But before I even do that, I want to ask, how could we prevent it? Are there any preventative measures that you encourage, I'm putting in quotations here, the healthy individual, someone that doesn't have or hasn't been diagnosed with this yet? You talked about diet, you talked about age. Obviously, we can't help getting older. We can help the diet. We can help exercise. Are there any pieces of advice or requirements or things that you're encouraging the healthy folks to take to, we obviously can't control this 100%, but how can we put ourselves in the best situation?
Yeah. And I think, you sort of nailed it on the head. There's no way to prevent kidney cancer.
Yeah.
So the best way to reduce the risks is, try and eat a better diet, getting in the fiber, getting in water, staying well hydrated, stop smoking, all the things we think about. And people are so sick of hearing, and they're like, oh, it's easier said than done. but it's the truth. It's what's going to help give your body that balance that it needs in order to stay healthy and try and keep those checks in place.
Let's maybe segue over to the cure question.
Yeah.
Let's say, someone's diagnosed. I would assume this, like most cancers, have various stages or degrees of impact or where it's at in its journey. Can you talk a little bit about maybe the typical treatment process, how this is typically handled?
Sure. 2/3 of the patients are diagnosed at an early stage. And so the survival is really good for those patients. Good thing is we do have 2 kidneys. Yeah. So if you do have, an issue, they could do, a partial sort of removal of the tumor. They could take one kidney. You still are able to live with the other.
Sorry to interrupt. When someone has kidney cancer, does it typically only affect one? I should know this. That may be an ignorant question. Does it not impact both?
There are people where it does come up in both. It's called focal and dual laterality. So the more tumors you have within the kidney and the more kidneys that are involved, 2 versus 1, it's going to increase, the risk for severity, also increases the risk for a genetic component as well.
Got it.
But yeah, so once they sort of have that early stage, surgery is considered. Obviously, there are some treatments that are considered as well, but they tend to have a very good outcome. The problem is the 1/3 of patients that are diagnosed later, again, because those symptoms aren't overly apparent. So those patients, surgery could be an option, but there's definitely going to be drugs involved, whether it's before or after the surgery. And you still have about 30% of patients who build up a toxicity to the drug. Cancer drugs aren't easy.
This is the chemo, radiation, we're putting them through the full cycle.
Actually, with kidney cancer, they don't do a lot of chemotherapy. They're doing more immunotherapies. So you're taking either a pill or getting an infusion, but it's not that same chemotherapy that we think about. It's really trying to elicit an immune response instead of kill off cells.
Got it.
Yeah. So the problem is if they're not going to react to that and they're getting toxicity, they've got to change medications. So even if it was working well, they're not handling it. So it needs to be changed. And the survival for people that are diagnosed at the late stage, so for that 30-some% of patients, it's lower than 20%. So we really want to make sure we get in an earlier diagnosis to get that better treatment.
Yeah. This is a tough question, but you've been able to sit on this side long enough that I'm curious if you have any, can you talk a little bit about the emotional and or physical toll that this takes on a patient and a family? This isn't like when someone in your family breaks an arm and you're able to slap a cast on it. For a few weeks, there's this point of like, let me go get you a drink and let me make sure you're okay. But it kind of wears off and it dulls. And at some point, that person with the cast is able to take care of themselves. They're able to handle things. And this cancer introduces something totally new lots of times. It impacts obviously the individual on a physical and emotional level, depending on the severity, and people handle it differently. And it impacts the overall family. I mean, there were times, my stepmother, she ended up having a stroke at one point. We had to reteach her how to walk. Like there are things that involves many more. And I just wanted to take a second and see if you had any, I don't know, anything to maybe just double click on or share about the impact and just what this looks like overall. I know it's a very generic question.
Yeah, I know we tend to think of like bad words as having 4 letters. I would disagree that cancer is probably the biggest one for people. The minute you hear the C word, your mind goes so many different places. And you're right. It's not something where, okay, I'm going to go in and I'm going to do this. And in 6 weeks, I'm going to be fine. And my joint may ache when it rains, but I'm not going to really have to worry about it again. It's not short of like, again, I go skiing again, I may break another leg, but overall the risk is low.
Exactly.
When it comes to cancer, even for those patients where treatment is successful, it's very hard to ensure that every single cancer cell has been removed from the body. Even when you remove an organ, there's still extra cells that are in the margins you may or may not get when you're removing tumors and so forth. And so these patients, they think they're doing well, then they may relapse. They may then have to start another treatment, or it's a trial and error with treatments. A lot of the kidney cancer treatments are specifically designed or studied around one particular type of kidney cancer, which is clear cell renal carcinoma. But there's a lot of different types of kidney cancer. So these treatments may not work as well for them, and they're just really trying things. I know some patients that were diagnosed, 15 years ago. that are still being monitored, still making sure it's not coming back. You're always sort of worrying about that in the back of your mind somewhere, no matter how much time has passed. And so cancer is a completely different beast.
Yeah. First, thank you for sharing. I can relate to that on many levels. So we've talked a little bit about the problem. We've talked about the individual. We've talked about the family, ways to handle this. For the lack of a better term here, but lack of a better question, what are you doing about it? Like what are you guys doing here? I've looked at your website and I see that the increase in government funding from 2016 to today has been significant. And I understand
almost fivefold. It's been wonderful.
You play a huge role in that.
We are still lagging behind breast and colon and all of those numbers. But I mean, we are in the top 10 in terms of cancer, 6th for men, 9th for women. So there's still more to do. Ourselves, we try and also fund projects that we think aren't going to be something that's going to take 10 years to continuously develop. We want things that are going to have an immediate impact. We were talking a little bit about the psychosocial sort of effects of cancer. And one of the things KCA did is created a research grant specifically around psychosocial issues in dealing with cancer, really to help move that research, help that support for patients. And we've also added in a patient navigator program. So, you call other places, you get a phone tree, you get some, blanket recorded message. Here you're getting a live person that's going to help you find resources, support, information to really guide you, personally with that journey. So we're doing the best we can to be that hand holder for people and their families that are dealing with these diagnoses.
Yeah. So you talked a little about the support piece. I mean, as I dug through your website, I saw you have lots going on, many moving pieces, ways that you're involved and influences. I saw 3 core pillars, and I maybe made these pillars up. Maybe you guys have them labeled internally.
We can hire you as our marketer. What do you got?
Yeah. The first was support and empower. And you just talked about the patient navigation program and the just diagnosed toolkit. So once someone is diagnosed, there's a sort of a packet or template on your website that can start to just help them understand, here's what's going to happen next. Here's what's going on emotionally. And you sort of give them a step-by-step of just the getting started phase. There's also an education piece of this. And I saw on the website symposiums, you're giving away loads of money. I think it's like $1.5 million. I don't have that written in front of me.
1.375.
There it is. 1.375. Can you share a little bit about that? I mean, what these different programs, grants, funds, what's going on here?
Yeah, so the education goes from both the patient and the doctor side. Patients educated, they take it back to their doctor. Doctors educated, they can treat the patient better. So we have a big symposium coming up for doctors and providers in November. And so we have a 2-day conference with new, information and research out there. We bring together a group called the Think Tank that really dives into brainstorming of where are the gaps? What can we do to overcome that? We do have patient materials. We're creating new ones all the time, but we also have a patient educational symposium. It's done virtually in September. And so patients can get on to listen to talks from their peers. They have panel discussions, physicians get on board, and it's just sort of an open call to just have information for them available. So those are the 2 big ones. And then our grant program, which we're in the process of reviewing, sort of 18 finalists for 3 grants programs that we have. So we give out a total of 7 grants across those programs for that 1.375 million. I'm really excited to see where those projects are going to take those people.
Yeah, same. And that really, really cool program. Especially you're giving away multiple within each of these steps, which was, like you said, that's great. 2 more questions for you. One, talk to me about you've had significant growth here over the last 3 years. You mentioned 2 to 12, 13 employees. We talked about the growth we've seen in funding, and while you're not where you want to be, we're making move up and to the right. It's movement in the right direction for sure. Let's talk about, 3 years from now, or 12 months from now, any big programs, plans, anything fun or exciting that you want to talk about? Are we going to continue to run the plays that we've discussed today? Like, just kind of give me some insight into the future. Where are you headed with this?
I think, we definitely want to continue with what we've been doing. That ain't broke, don't fix it. So that's definitely moving forward. But we have 3 really big things that we're excited about. Number 1 is, I mentioned those rarer types of kidney cancer that don't tend to get as much attention or research. And we're really trying to focus on ways to get those people involved in research, get those people educated. So the focus on those rarer tumor types getting them in clinical trials, getting drugs out there for those patients. One of the ways we hope to do that is through something we're calling the Data Federation. It is a very large, multi-center sort of institutional way to pull data together from thousands and thousands of kidney cancer patients through a cool new like assisted artificial intelligence technology that we're going to be using. But it's going to have a patient arm where patients can get involved directly, whether or not their institution is involved. So those rare cancer patients can send in information and become part of that big data source. So we're excited about that. And we're also increasing the patient assistance fund. One of the biggest things we have, over 30% of the people that call in, they're having not just trouble with medical bills, but getting gas for the car to go to appointments, especially if they're in rural areas and are driving far. So really increasing that fund and how we're going to distribute funds to help people pay for their medical bills and ancillary things of life when cancer throws a sort of wrench into the system.
Yeah, that's one thing I wanted to talk about, and I decided to X out at the last minute, was just the financial burden that this puts on families. That's a whole nother, we could talk another 20 minutes on, there's a physical sort of push that happens on the family, physical influences, there's emotional, and then there's this monetarily one that sort of lags behind. And after you deal with all the emotions and the physical, you're left with this financial piece that you have to solve. And it's just endless battles when you get into this type of situation. So the fact that organizations like you exist and you're educating and you're giving guidance and you're giving just diagnosed toolkits and you're giving guidance, I think it's so important. Sitting on my side where we were thrown into deep dark waters with no guidance, it's a scary time. Let's say someone is tuned into this and they're, lack of a better term, excited about what you have going on. They've heard the future, they've heard about the influence, the impact that you've had, the growth, the scale. What are some ways they can get involved? We're going to have people that are local to us. We're going to have people, as I mentioned, I've talked now to people all over the globe. And so both local and non, how could people be involved?
Well, I told you it would come. So one way to sum it up is orange up, y'all. Yes. And basically for us, orange is the color in the United States for kidney cancer awareness. And so there's places on our website you can go to get involved or to ways to give. Funding and awareness is the way that's going to drive this. And so by oranging up, you can help learn about kidney cancer, figure out how you can spread the word about kidney cancer, how you can get your institution involved in things, as well as ways to donate. 100% of the funds that are donated to us go to those initiatives we've been talking about. We're very proud of that fact over the last 30 years. And so we really want to make sure we can't do it by ourselves. We need help from the community, from patients, whether you have cancer or not. It's something that's going to affect all of us. Every single family is going to have cancer in it somewhere. It may not be kidney cancer, but this is the one piece of the pie we feel the most strongly about, and we could definitely use support.
Yeah. I think, like you said, just echoing, I think everyone can relate to the aura or the environment, like what the feelings that come with this. Not everybody can relate to kidney cancer, but everybody can relate to cancer, the C word. And it's heavy. And like I said, I think that the fact that organizations like you guys exist, that you're out there and you're having a positive influence and you're pushing people in the right direction. And it's so powerful. I'm a huge fan. I really appreciate the time. And thank y'all for listening. Thank you for joining though. This was so much fun.
Thanks for having me, Joshua. I really enjoyed it.
Of course. Yeah. For those of you listening, if you enjoyed this podcast episode, please press subscribe on your YouTube and your podcast app. This will show the algorithms that this is an important conversation. So more people can learn about the importance of not only staying proactive with you and your family's health, but also to stay in the loop with what some of the industry's top programs are doing to fight back against these parasites.